This podcast is intended for educational purposes only. For more information and our full disclosure, please visit NC-MIDWIFERY.com and our podcast page. Well, welcome back to another episode of More About Birth. We are actually on the road today. That's right, Sunnyside, Washington. Ladies, what's this about?
You know, actually, this is Angie's thing today. I'm clueless, guys. So we are out of town today. This is really fun. I've met some new friends, and we're going to learn some really incredibly good things today. In fact, we even have a new word that Angie hadn't even heard of. So, Angie, take it away.
All right, guys. So today, one of the things we're going to be talking about is chirodontics.
Chirodontics.
No way. Another word by Angie.
Chirodontics. It was even new to me. And also the real pandemic of obstructive sleep apnea in children. And we have a lot of information to cover. We're going to try to hit all the good things, all the highlights in the short amount of time that we have. So bear with us while we wade through this. But we are super excited to bring this podcast, and I really hope that you'll stay tuned because you're going to hear about how chirodontics can help your labor.
Are you sure?
Yeah, for real. It's out there, but it's real.
Got it. Stay tuned.
Yes, so please stay tuned because, you know, anything that can help your labor is a bonus, right? The optimal development of your baby and any of your other kids. And you definitely want to consider this whole program that we're going to present if you care about the foundational building blocks of your child's future and their growth and development and their well-being. And Shannon, tell us the little hot topic that we're also going to touch on.
Okay, I really wanted to throw this in because after talking to our new friend, Jim, we have discovered that he agrees with us about how bad it is for your kids to wear masks all the time.
What?
He's got some information for us having to do with the topic we're talking about today as far as oxygen intake and the effects on your body and your life in general, and how your children wearing masks can be detrimental.
Right. So you guys, here's a quick
about that one.
list of things that this whole program talks about and addresses. So one of the things is sleep apnea and just oxygen intake in general and how it affects your body. And so if you or your kids or anyone you know has struggled with any of these things, stay tuned because we're going to talk about it. And here's the list. Speech, learning, mood, brain fog, growth and development, weight and height, yes, snoring, depression, headaches, sore throat, tooth decay, dry mouth, large tonsils or adenoids, thyroid function, and really the function of all of the organs in your body because they're all affected by oxygen intake. Mm-hmm. So that's our little intro. And now I am very happy to introduce to you our friend and dentist and oral health medicine aficionado, Dr. Stevens. So thank you so much for joining us and having us come into your space today. And can you give us just a little background on yourself, how you got into this and what you've been doing with your life?
Yeah, we've been in dentistry here in Sunnyside for about 45 years.
Woo! Long time.
Yeah, one of the oldest guys in the state anymore. And we started doing the sleep apnea, airway probably 25 years ago or more. And it was a different animal then than it is today. The progression has been tremendous, and especially in the last 5 years. A lot due to this group here, Vivos. Started out with Dr. Dave Singh, who's a genius in genetics and an orthodontist, came over from London and practiced here in the U.S. And he developed a procedure called epigenetics. He used the concept of epigenetics to develop an appliance that looks like this. And this is kind of an endpoint of helping kids that have inadequate development. It looks like an orthodontic appliance. It's not. It's an orthopedic appliance.
Okay.
And so one of the concepts that we're talking about is both of you have expressed interest in chirodontics, is orthopedics.
Okay.
So how does that affect the topic of the day of young children, moms that are giving birth? The orthopedic aspect of this is that, as you mentioned, the pandemic in this country today is airway obstruction of children, honestly. One of our Vivos doctors in New York is a pedodontist, and he said that 80% of his kids have obstructive sleep apnea in some form or another. 80%.
That's huge.
At what age starting?
That's huge.
Like,
His practice
as
is
young as?
starts at age 2. It starts at birth.
Oh, wow.
And if the child doesn't develop properly, if they're not nursing properly, and they're getting that little tongue up here and latching on properly, and that tongue is an incredibly powerful muscle.
Yeah.
And you do a cross section and look at those muscles anatomically, it's quite impressive. And so today, for you and anyone else, that tongue is still an orthopedic appliance, more or less. It has an orthopedic function. We use that a lot as we help adults that have obstructive sleep apnea today.
Can you explain to them what you said to us earlier when we were talking about how the palate, the roof of the mouth, the floor of the sinus cavities, how that's affected by the tongue?
Sure.
And as far as it flattening out during nursing or
Right, and
with
how
proper
tongue tie
use?
affects all that.
So the tongue is an incredibly important piece of anatomy to development. And that tongue gets up in there. So here is this little baby that's essentially made out of clay. And it's so malleable. And that tongue, if it's nursing, this is a marvelous system we have. Absolutely marvelous. If we allow it to function the way it's supposed to. And that little tongue gets up there in the roof of the mouth with that sucking action. And pretty soon this little mouth starts to go like this, and the palate develops this way. But if we're sucking on a bottle, or we're not latching properly, and this little baby's going, guess where the tongue is? The tongue's down here. Instead of the palate going like this, it forms like this. And the palate is part of a bone called the maxilla, which doesn't make any difference, but it's just as easy to say as the upper jaw. And so there's the upper jaw, and it doesn't matter whether you're 60 years old or 6 months old, that's the upper jaw. And so there's the palate. It's all part of that, and there's that. There it is. And so as we look at that, one of the interesting things you'll see about the palate and the roof of the mouth, it's also the floor of the sinus.
Wow.
Whoa. So if the palate expands, it's pretty, once you look, you said, well, that makes sense.
Makes sense, yeah.
Why didn't I think of that? And so if we expand the palate, then the nasal cavity is going to expand as well. And so we're also going to be able to breathe more easily through our nose and nasal passages as a result of the palate being the correct dimension.
So who would have thought orthodontics affecting the sinuses unless you'd used that? And I've never seen that. I'm 58 years old. Oh, I'm 59 years old.
Get it right.
Oops.
So I thought of a quick question. I have so many questions. I'm going to have to squelch myself today. But bottles. Some moms, they just have to end up bottle feeding. There are truly moms that have to. So the newer bottles that we have now with the very wide bases, are those much better than the narrow base nipples then
Yes.
for tongue and roof of the mouth development?
Yes.
Okay.
So if you have to use something that's bad, use the best of the bad.
Okay. So the
Makes sense.
wide base, most like a breast.
Right.
Okay.
Right.
And this is actually, so as we talk about this, and this is the distinction that we specifically make in our airway analysis. This is oral medicine, actually not dentistry. That's one distinction. And our dentists that are providing this type of service, one of my roles as a clinical advisor to have 10 or 15 dentists that respond to me is that you're a doctor of the mouth and this is oral medicine, not dentistry. It's very different. And the presentation of it, the follow-up is very different. And the potential results or poor results are life-changing to these patients.
Wow.
When you mentioned that it was similar to like chiropractic, therefore the new big word, and also that it's a little bit similar or like craniosacral.
It is craniosacral.
It's
We're
essentially-
affecting that.
okay.
We call it craniomandibular. So mandibular is the lower jaw.
Yeah.
And so we have the cranial part and the mandibular part is craniomandibular.
And then you had also mentioned that this is a perfect complement for chiropractic care.
We work hand in glove with chiropractors.
And you said speech therapists.
All kinds of healthcare providers.
We call them myofunctional therapists, and these are a budding group of professionals that deal with correct swallowing, correct tongue position, correct breathing. Breathing is huge. We have
It's pretty big.
we have whole courses
Sorry.
now.
Thinking it's pretty big. You got to do it.
Yes, and it is, but we don't breathe correctly. And so there's actually breathing classes, breathing instruction.
Really?
We refer our patients. Person I'm using right now happens to be in Omak, Washington. She's 200 miles away from here.
Wow.
And it's so important that the first appointment, the patient actually has to go there.
Wow.
Yeah.
And so they may do a tongue release.
Oh.
You talked about tongue tie.
Okay, yeah.
So the tongue and the floor of the mouth should be able to function like this, and it's attached by a ligament in here. But sometimes that ligament's way out here, and the tongue doesn't function properly. And so we have release, and these tongue releases are easy, but very important. And there's new techniques out that are being used, and it makes a tremendous difference in our ability to get the optimal results from our treatment to get this palate to expand, because we can get that tongue up where it's supposed to be to help us with the work it's supposed
So
to do.
which type of treatment do you prefer that as far as the tongue tie releases? The laser, the clip?
There's a method now Dr. Zoggy in Southern California developed. It's called the Zoggy technique, if you can imagine that.
Gee, imagine.
And so that's the rage today. The laser is okay. It depends on the element of the tongue tie. And also myofunctional therapy is very important towards maintaining that release. Otherwise, it'll have a tendency to grow back.
Right.
Right.
And we
I've
don't
seen
want that to happen. So that will grow back. And so having the myofunctional therapy before and then do the release and the myofunctional therapy after. And using the Zoggy technique is often the best way to go.
What's different about that technique?
Well, the Zoggy technique, instead of just clipping this front ligament, the Zoggy technique will extend back into as the tongue is here, back more into the floor of the mouth and release some of the muscles that are causing the tongue to be retracted.
Okay,
Oh,
we'll have to look
interesting.
that up.
Restricted.
Yeah, that's interesting.
Yeah, we'll have to look that up.
Okay, so I hope you guys are following along with this. Just to recap, now this is very crudely stated, I'm sure, but just like to put the pieces together here. So we have a lot of people, and particularly for our audience, a lot of kids running around with compromised airways. They're not getting the oxygen intake like they should be, and this is going to affect a whole range of things. The list that I mentioned, sleep apnea and oxygen intake, both of which affect your growth and development, your moods, the way you're able to learn and process information, and all these different things. Tooth decay. I mean, who would have thought, right? But so the goal is to use the appliances. Maybe we should pull some of them out. And you fit these appliances specifically custom to the person or the child. And over time, without pain, they spread the palate, right? The upper palate. Am I getting this all right? They spread the upper palate and actually change the airway.
And you've tried this yourself, correct?
Yeah, we're doing this with our kids. And actually, if you guys stay with us till the end, there's going to be a little bonus segment. We're going to go back with Dr. Stevens to his office and the computer and his little, I call it the spacecraft, 3D X-ray machine.
Angie's empty head picture.
What?
I don't know if it's actually me, but we're actually going to see the way you can measure the airway and get a picture of it.
That's amazing.
And how it changes and how, like pre-appliance and post-appliance. And so once you're able to move that palate and open up that airway, you're able to correct some of these issues that otherwise actually just get worse over time.
We need to quit having podcasts. Now I need to do Pilates.
I
need
know,
more
that's
chiropractic
right.
visits. Now I need this treatment.
I know.
Yeah, but we're getting educated.
We're getting educated.
We're getting educated.
So let's take a look at some of these appliances and actually see what this process kind of looks like.
So one of the things that you asked about is, so how young does the kids develop this issue?
Right.
And it's a progressive issue. Now, our grandson was 1.5 years old and he suffered from sleep apnea. My son happens to be incredibly knowledgeable because he works for Vivos.
I'm sorry, I have another question already, but people are going to be wanting to know, how do I know if my small child, like my 1-year-old, has sleep apnea?
Do they snore? Are they breathing heavily? Do they have circles under their eyes? You call bags under your eyes?
Is bedwetting part of it?
Bedwetting is definitely
because they're not
part of
waking
it.
up.
Exactly. Well, and they'll.
Why are you looking at me?
Because I'm thinking one of our children fit all of these bills, and I will not
As
As long as it's not Keith.
Just
then
for the
you
record,
will.
just for the record, I want everybody on more about birth. I don't wet the
It's
bed.
not Keith that wants the bed.
I do snore, and I do have bags under my eyes. And what was the other
She's
list?
get back for a European trip with those bags. Sorry.
Okay. So anyway, sorry, doctor.
Is this the end of the confessional?
Oh my goodness.
This is into the confessional.
We always have too much fun. Just
Okay.
So our grandson was having these issues. He was actually on his knees in bed. It looked really cute, but this kid couldn't breathe.
This is like what I call the duck butt syndrome, right? Where
Yes.
they're on their chest and it looks really cute, but you're saying that's
really?
not a good way to sleep?
The reason he's on his knees leaning forward is because when you do that, then the airway opens up. And that's the only way he can get his
Wow.
airway open enough to breathe.
Who knew, guys?
sad.
In adults, we'll see people walk around like this.
Yeah.
A large reason for that is that opens up their airway. This is a
Wow.
real indication.
Wow.
of
Kind of
sleep
like that
apnea.
head thrust forward thing.
Yes,
Or bad
exactly.
posture.
So in your community, sorry
Stand
to,
up
this is
straight.
just fascinating me. In your community, are they thinking that there's a different way we should be sleeping? Like, are the beds we're using and all that, all these years? Is there any talk about, because there's all kinds of new beds, new pillows that come out all the time. And you're saying that even the way you lay down and sleep at night could be causing problems, and that could come from your orthodontic history, correct?
Vice
Other
versa.
way around.
Vice versa. Okay.
You're sleeping that way because of your
Wow.
actually orthopedic.
Orthopedic.
So the difference between orthopedics and orthodontics, and we make a distinction between that, not to be academic about it, but
Right.
is orthopedics is we're growing bone. Orthodontics, we're moving teeth.
Okay.
So in our arena, I leave orthodontics to the orthodontist. And what I tell the patient is that this is orthopedics.
Okay.
We're going to move bone. The teeth will move along with it. And very often we get a very nice result from that, but I will not guarantee that. And I also use an orthodontist. I have 2 orthodontists that I use. And I just finished treatment with one gal. She's 13 years old. And I referred her to our orthodontist. And we will work hand in glove with this patient.
Nice.
I don't want to pretend to even think that I can do orthodontics as well as a seasoned orthodontist can.
So orthopedics.
Learning lots.
Yes.
Okay, so back to your grandson
appliance.
with the duck butt
so-
sleeping.
So little Wyatt, the great little guy, and of course. And so this is the appliance that we use for him. And it's pretty tiny. In fact, the one that we used for him was actually even small. I use this because it's easy. Oop. Great
Oh,
hands.
nice
catch.
catch.
On camera.
I used to be a
Dental
catcher on the
hands.
high school baseball team.
I was going to say, under
It
pressure.
shows.
And too much fun. And so we fitted him with one of these. Before we did it, we did what we call a pharyngometer check. And a pharyngometer is a machine that measures
Another
airflow. And you put the little device in the mouth, the patient
Oh, like the little tubes they use for asthma.
sort of only
No?
different.
Okay.
And then this is hooked up to a computer, so we get a computer reading of airflow from here all the way down here.
That's fascinating.
So to see a little 1.5-year-old doing this
Wow.
was hilarious.
I bet he probably thought it was a fun thing.
He did it. I wouldn't want to try it for every little kid that age. So we fit him with one of these appliances. He's doing great right now. He's 5 years old now. He sleeps well. He's not having a problem. His arch is widened.
Do they stay in really well?
It's a habit. Little kids adapt to this much better than adults.
But you wear them at night and as much as possible during the day. But it's not a permanent thing. It's not like
Right.
you stick it in there and then it's there for months.
So it's and the way that my son got little Wyatt is that when they wanted to watch TV, you have to have the appliance in first.
Wow.
Or you don't watch TV.
Equitable trade.
Yeah.
Yeah.
I'll wear it, Dad.
Awesome.
Yeah, that's cool.
Yes.
So the other appliances that we use, this one graduates. We may go, depending on the age of the child, we may go through 2 or 3 of these. We monitor these kids very closely. And
You said every month you see them, right?
ostensibly for some of it, for these kids, we may go, sometimes we can go 2 months depending on their growth and development. And their compliance. Compliance is huge. And so then when we achieve a certain point, then we will move to this appliance. This is, if we need to, this is called the DNA appliance. At a certain juncture, these appliances, probably about 12 years old, we have reached the maximum of what this appliance will do. Sometimes we'll go as far as 13, but rarely beyond that.
Is that because the growth has kind of slowed down so much by then, or is there another reason?
This appliance is more specific.
Okay.
So now we have adult dentition. This one has either mixed dentition or what we call primary or the baby teeth. Now we have full adult dentition. So we moved to we call this a DNA appliance. This is a removable appliance, optimally worn 16 hours a day.
I could sleep 16 hours a day.
I know, right?
This may be ideal for you.
It's. I don't think it's the same thing, babe.
And so this at nighttime definitely needs to be worn at night. Night is when the growth and development takes place, but it also needs to be worn during the day to pick up those 16 hours.
Okay.
What'll happen with this appliance, different than orthodontic appliances, is this appliance doesn't hurt.
Huh.
We
Yay.
expand.
The best.
Big points.
Best.
No, if we have pain, then we have to back off. This is not the way this appliance works. We put the appliance in, it's in there 16 hours. These little springs right here, if you can see them, will vibrate at a high vibration rate. It's a special metal. And when those vibrate on the front teeth, it stimulates these stem cells down around the roots of the teeth. And when those stem cells are stimulated, it wakes up what we call osteoblasts, and that's what grows the bone.
Lots
Now
of
we-
new words.
Awesome. And
Wow.
this is even for adults, right?
This
Isn't just for kids that are growing.
we've used this successfully with an 80-year-old adult,
Wow.
and he was able to discard his CPAP machine.
So if it's
So
stimulating-
so evidently that's how Betty White has lived till 99 years old. She probably is seeing someone like you.
crazy. If it's stimulating the stem cells, do you find that the gums quit receding and come back more naturally? Does it affect other things?
I think that it's independent of gum recession. Those are two different functions.
It doesn't tend to make the gums develop a little bit more, whereas they've been receded. I'm just thinking stem cells kind of do a lot with everything.
Potentially they could, but our finding is, and that's a good point and accurate. For this, the stimulation here, because it's on the teeth, stimulates the bone to grow, the regeneration of gum tissue. We don't, at least to my knowledge, I haven't seen evidence of that happening.
I was just curious
No,
because
it's a
I'm
good
thinking.
Hey, it's the next field of research.
And actually, I had the exact same question.
Did you?
Because my dentist says my gums are receding, and I was just curious because you're talking about making bone grow. So how do you make gums grow?
That's
Do it, guys.
It's an excellent question. There's probably somebody out there that has a better answer than I do.
Right.
There's your moneymaker.
There you go.
So gum recession is generally caused from clenching, grinding, bruxing.
Can I hold
Sure,
this? Is
your
that all
turn.
right? I just want to
Oh.
look at it closer. That's crazy looking.
So what it does is that when wearing this, so let's create some thumbnail timeline and dimensions. If we're wearing this 16 hours a day, at the end of 1 week, ostensibly, this will get loose, and we have a little key that goes, there's two screws in there. One for this split here, and the other one for this split here. So one will move this unit this way, one will move this unit this way. And at the end of 1 week, with 16 hours of wear, we can expand that screw. We have to put a little key in there and crank it this way and crank this one that way. This will expand 1/4 of a millimeter. So theoretically, every week, worn 16 hours a day, we can expand this 1/4 of a millimeter.
How do you know when you're done?
Your teeth fall out. No, just kidding. Sorry.
Such a smart
that's a
aleck.
very
You're
good- that's a very
breathing.
good question.
You're breathing normal, right?
So what's our goal? So we start out and say, person comes in, I'm not sleeping well, etc. What is your goal? At the end of 6 months, we reassess, we take new records, etc. We assess, where are we now? At the end of 12 months, we do a total reassessment and find out where we are. Have we achieved the breathing and sleeping that we wanted to achieve? And other issues, maybe you had headaches, neck aches, back aches, etc. Have we achieved that? And sometimes there's a tooth alignment. Have we achieved a form of the arch that's appealing for the patient and that sets us up for a good orthodontic result?
Right.
And then if we have, then that's the end point. So another question is, well, if you keep expanding and keep putting new appliances in and expanding the screw, would you get a jaw that's like a Ubangi? And the answer is no, because it will only expand as far as the genetic code.
Okay.
At some point,
I'll just stop.
it'll stop. It'll stay tight and won't get loose anymore.
Interesting.
Huh.
Okay, I think that is actually a perfect breaking point. So we are going to take a pause there. And this has been wonderful. I truly hope that you guys will tune in for the next segment, the next piece of this podcast, because we have all the things coming up that we promised you. And I'm going to recap those here for you. We are going to talk about why you should rethink traditional orthodontics for your kids. Really, really great topic. We're going to talk about how these appliances can help your labor. Really exciting, right?
Woohoo.
And we're going to touch on what Shannon said, the hot topic of why you might want to rethink putting a mask on your kiddo. All right. So thank you so much for joining us. Thank you, Dr. Stevens.
Oh, you're welcome.
And we will see you guys back for the next podcast.
See you later.
Bye.
Thank you.
Well, thanks for joining us for more about birth. That's part 1 here in Sunnyside. We hope you will join us for part 2. We'll see you then. This podcast is intended for educational purposes only. For more information and our full disclosure, please visit NC-MIDWIFERY.com and our podcast page.